Hello, I'm Natalie Merrett and I'm head of the Knowledge Dissemination team in the Schools Division at the Anna Freud Centre. Our vision is for all schools and colleges in the UK to be mentally healthy, and we believe that a whole school or college approach to mental health and wellbeing, like our 5 steps framework, can support education professionals to do this. A whole school or college approach to mental health and wellbeing involves all parts of the school or college working together and being committed to prioritising mental health. It needs partnership working between senior leaders, teachers and all school staff, as well as parents, carers and the wider community. Everyone has a role to play. It can help school and college staff who have busy workloads and competing priorities by providing a structure to support mental health and wellbeing and feed into development plans. We would recommend a senior mental health lead as the ideal role to champion a whole school approach. There are 2 key pieces of guidance which recommend taking a whole school or college approach to mental health and wellbeing. The first is from the Department for Education and Public Health England, who have co-created guidance which shares 8 key principles for a whole school or college approach to mental health. The second piece of guidance comes from NICE, whose Social, Emotional and Mental Wellbeing in Primary and Secondary Education report says that schools should take a whole school approach as one of their key recommendations. Although there is no one piece of statutory guidance on mental health, there are several statutory requirements for schools where mental health is included as part of this guidance. For example, safeguarding responsibility to cover mental health, the RSHE curriculum, the personal development section of the current Ofsted framework, and the SEND Code of Practice. The 5 steps framework will help you to take a considered approach to the mental health needs of pupils and staff, the importance of leadership, and the role of the community. The framework has been developed with mental health and education experts and is free, interactive, and simple to use. 5 steps aligns with the Department for Education and Public Health England's whole school approach guidance. 5 steps will allow you to methodically review your provision and make informed, strategic decisions. Each of the 5 steps includes 3 to 6 practical actions that you can take to make sure that promoting mental health and well-being is integrated across your whole school or college. Each action is supported by evidence-based practice, free or low-cost resources, case studies from schools and colleges across the UK which showcase how these actions have worked in practice. It can be tailored to your setting by using our action planning tool to rate where you feel your setting is in relation to the actions. When working through the 5 steps framework, your aim should be to make gradual improvements over time. We would recommend that a senior mental health lead coordinates this work, but it will need to involve all staff. We would encourage you to revisit your action planning tool every 3 to 6 months to update your progress and print out your own rated results. The action planning tool can also be built into your school or college development or improvement plan to clearly demonstrate your commitment to a whole school approach to mental health and well-being. For more information, guidance and tips on a whole school approach to mental health and well-being, we recommend that you visit the Anna Freud Centre website